Good evening all. Welcome to my YouTube channel DJ to Learn. Okay, so all of you know that today is World AIDS Day. So in this video we will discuss about the history of the disease AIDS and how it spreads among us and how we can be cautious, how we can make prevention from the disease. Okay, so let's start the video. So first of all, we will know the importance of the day. World AIDS Day is one of the 8 official global public health campaigns marked by the WHO, World Health Organization, designated on 1st December every year since 1998. It is an international day dedicated to raising awareness of the AIDS pandemic caused by the HIV infection. HIV is human immunodeficiency virus. Government and health officials, non-government organizations and individuals around the world observe the day with education on AIDS, prevention and control. So actually if we will look into this matter, so AIDS is not a disease, it's a condition. Actually AIDS is a condition. Acquired immunodeficiency syndrome is its full form, and it is not a specific disease. It is a condition in which our immunity power becomes so weak so that other pathogens of different disease can easily attack our body and make our body affected with different diseases. So AIDS is not a disease, but it's a condition in which our immunity becomes so weak. So we will discuss more about it. Okay, then history of the day. World AIDS Day was first observed on December 1st, 1988 to bring greater awareness to HIV as well as to commemorate those affected by the disease. Today, it is regarded as the longest running disease awareness initiative of its kind in the history of public health. Since those early years, the epidemic has changed enormously, and so too has the global agenda. With about 38 million people worldwide who have HIV, universal testing is the main key to halting the number of new infections. Testing will identify all those who need access to treatment, which will help those with HIV live longer and healthier lives. But with stagnating global contributions and an ever increasing infection rate in many countries, including Russia and South Africa, one could argue that there was never been a more important time to mark World AIDS Day than now. Okay, now we will look how it spreads. The most common methods of transmission of HIV are: first one is unprotected sex with an infected partner. Second one is sharing needles with infected person. Third one, transmission from infected mother to fetus, so it can be transmitted from infected person, infected mother to his child. Then infection from blood product. If we receive blood from a patient who is already been suffered by AIDS, so we will also infected by that blood. Then symptoms of AIDS. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS symptoms include weight loss, fever or night sweats, fatigue and recurrent infections. People may experience pain areas in the abdomen. Pain circumstances can occur while swallowing. Cough can be dry, whole body, fatigue, fever, loss of appetite, malaise, night sweats or sweating, then gastrointestinal nausea, persistent diarrhea, vomiting or watery diarrhea, then throat, difficulty swallowing or soreness, then groin, sores or swelling, then mouth, ulcers or white tongue. Also some common symptoms are opportunistic infection, headaches, oral thrush, mouth thrush, pneumonia, red blotches, severe uniintestinal weight loss, skin rash, or swollen lymph nodes. So these are the symptoms of AIDS. Then we will know how can we prevent from it. So first one, we have to be monogamous. Be sincere with your life partner. No need to be polygamous with unprotected manners. So in our country, India, our country is a what we call spiritual country. Here we believe in monogamy, so we should follow our spirituality, which will make a special position of us Indians in the world. So we will be monogamous. We should not do polygamy with unprotected manners, and we should not invite the disease from our side. Then second, when you are receiving blood from anyone, first confirm that he or she is not affected with AIDS. Then third one, do screening of blood before transfusion. Then 4, don't share injections, needles and instruments for tattoo, piercing and razor blades. Then do not abuse alcohol or drugs. And the most important thing is prevention is care. Prevention is better than care. So the most important thing to be cautious from AIDS is educate people about spread and prevention of AIDS. So if we educate people about how it spreads and how we can be cautious from the disease, we can make prevention from our level. So it will be more beneficial to stop the spreading of the disease. Nowadays it has already come to a limited manner, it come to control, but before some decades it was a what we call global pandemic also, like coronavirus. So till that we have to be cautious from the disease. We have to make some preventions, how to be cautious from it, how to be free from it. So we have to create self-awareness among us. We have to what we call make people awareness about the disease, how it spreads, how we can make prevention. So that's all we have to do as a citizen of our country. We have to make our hand for the development of our country, and we will work for creating awareness about these days. So this is the what we call motto of the day. So this is being observed on 1st December every year, only to what we call minimize the spreadness and to create awareness among the peoples. Okay, thank you all.